Welcome to eHealthTALK, a podcast from Health Informatics New Zealand and hosted by me, news editor at HINZ, Rebecca Macbeth. This podcast provides insight and discussion on key topics of interest from across New Zealand's data and digital health sector. Please be sure to like and subscribe wherever you get your podcasts.
Kia ora koutou, welcome to eHealthTALK NZ. Today I'm joined by Nursing and Midwifery Informatics Special Interest Group executive members Emma Collins and Alf Eggimann. Welcome on the show to both of you. So first, for our listeners, can you briefly describe your day jobs and the role of the Nursing and Midwifery Informatics Group? Starting with you, Emma.
My day job is I work at the University of Otago and I work in the Department of Women's and Children's Health, where I help teach medical students child health. My research angle is in digital health, and I also am doing a PhD in the virtual reality space. And I'm currently the chair of the HINZ NMI group, and the role of that group is to encourage nurses and midwives to engage with health informatics and with Informatics New Zealand. It's to strengthen and advance the visibility of nursing and midwifery informatics in New Zealand and internationally, and we namely do that through the International Medical Informatics Association called IMIA, and they have a nursing informatics group that we have connections with. We're also here to strengthen and advance nursing and midwifery informatics through practice, policy and innovation, leadership and research. And of course, we like to be able to acknowledge excellence in nursing and midwifery informatics, and we do this each year at our annual workshop.
Thanks, Rebecca. Nice to have the opportunities to talk. I'm a midwife by profession, and I've tempered in digital and emergency response for the last 7 years or so. I currently work in cyber incident response for Health New Zealand, and I'm actually also doing an executive MBA. For me, I see Nursing and Midwifery Executive Group as a way to actually promote the importance of digital technology. And this is about both streamlining and optimizing healthcare for patients, but even more importantly for the clinical workforce. It's about enabling midwives and nurses to have a voice to talk about what actually happens at the coalface. And I also see that technology, if you like, as a way to strategize and think about the bigger picture. What are the global concerns in healthcare? How can the workforce shape what solutions might look like into the future? And I think that digital health is very much a part of this. So if we open that door, even just slightly, for midwives and nurses to take an opportunity to push it open.
So how does health informatics relate to the work of nurses and midwives?
I kind of see that health informatics, it relates closely to the work of nurses and midwives by having the potential at a strategic level to transform the way that they deliver care and interact with patients, colleagues, health systems. We utilise informatics tools like electronic health records to ensure that nurses and midwives have up-to-date and accurate information about patients. These types of things improve clinical decision-making, reduce errors, and enhance patient safety. Nurses and midwives already use informatics. We might just not call it that, right? But it's about collecting, interpreting, analysing patient data. It enables what we already know, which is, gold standard evidence-based practice. So it supports those kind of treatment and care plans by latest research.
Just for our group, the HINZ Nursing and Midwifery Group, we tend to go by the International Medical Informatics Association definition, which is that nursing informatics, science and practice integrates nursing as information and knowledge and the management with information and communication technologies to promote the health of people, families and communities worldwide. So it's a real intersection of the nursing practice, the nursing kind of day-to-day nursing practice that we do, the information that we gather from that, the knowledge that we generate from it, and how we use information and communication technologies to assist in that process. And we do this to inform our daily practice. So nurses use informatics every day. Nurses are the ultimate data gatherers. We just don't tend to think of it in that sense.
Thank you, Emma. So new technologies are always being adopted in health, but how do we ensure digital solutions are designed around clinical workflows and with users like nurses in mind?
The answer to that question is relatively easy. We just need to have nurses and midwives at the table when these technologies are being looked at, being adopted. We don't just need nurses and midwives from when the new technology has already been purchased and onboarding needs to happen. They generally, go to nurses for onboarding with that kind of stuff. But that's far too late. We're too far down the track for that. Nurses and midwives need to be right there at the very beginning of the process. They need to be involved in identifying, first and foremost, what is the issue. So what's the concern that you're looking at a new technology for? Do you actually need a new technology for that issue, or is it something else? So they need, right from there, they should be involved in that identification of what the actual problem is, and then working as part of a team to identify a solution to that problem. If that solution includes a new piece of technology that needs to be adopted by staff, then, that's great. Keep having nurses and midwives involved, but we need to be involved right at the beginning before a decision's made about a product. If they're involved only at the end, it's too late.
The only other thing that I'd add to what you said, Emma, was continuous improvement. So recognise that clinical needs and workflows evolve over time. So establish systems for continuous feedback and updates to ensure that digital solutions remain relevant and effective.
Are nurses and midwives keen to get involved? Because, as you said, they might not always think of themselves as data and digital people or gatherers. And also, I imagine, having experienced some IT projects that haven't gone well, they might be less inclined to get involved in new ones. How do you create enthusiasm and optimism amongst them to step up and make sure that the solutions are going to work for them?
I think that every single clinical person and most people who work in health are fully aware of the problems that exist across that health space, but also have an inherent desire to fix them as well. So I think it's about raising up that platform that is, if we call it informatics or not, but it's about digitization of systems. It's about improvement. So if we can level that up and kind of begin to explain to people that it's not a series of little, code courses that you have to take, or you now have to become fully IT literate. It's nothing like that. It's about looking at how do we redesign the system and how do we how do we insert ourselves into the middle of that picture when the doors are not necessarily open. And that's where I think that this is, what Emma and I are really keen on, and is engaging that workforce and making them aware that digital spaces are quite accessible.
PINS and the Nursing Midwifery Informatics group are running the eHealth Nursing and Midwifery Workshop as part of Digital Health Week. It's on December 3rd in Hamilton. And one of the panel discussions you're hosting is on amplifying the nursing and midwifery voice in the digital health nursing and midwifery workforces. So what are your thoughts on how this can be done, Alf?
We could talk for days about the benefits of taking opportunities. Nurses and midwives can take opportunities to develop leadership within projects. They can co-design with digital developers, represent within decision makers, and there are many educational opportunities. But I think that the most important thing that we need to kind of make top of the list is that digital is about health, right? It's about strategy, and who is better to strategize about the development of healthcare than the people that work on the front lines. And midwives and nurses should be engaged at every level of the system. There shouldn't be a governance board or a decision-making entity that doesn't have a member of this workforce. But I have to say that one of these key things to do is to network. It's about developing relationships within the space. And it's like coming to days like the HINS workshops or the conference. It's about talking to unions and leadership forums in the communities that they work for, because they may not all work for huge organisations like Health NZ. And lastly, really, it's about creating a culture where nurses and midwives actually feel empowered and equipped to contribute meaningfully to digital health. It does require structural changes, supportive leadership, and a commitment to education and professional development. But it's about amplifying the voices of those frontline professionals.
Well, I absolutely agree with everything you've just said, Alf, and I especially like what you said around, just creating that culture, and that's what I, believe as well. It's around about the mindset, and that every nurse thinking that they are a digital health nurse, and I do, and I do work a lot in the kind of undergrad space, so I do believe that we need to instill this in every student nurse right from when they enroll in nursing school or midwifery school. Nurses need to have the competence and confidence to speak up about new technologies that are being introduced, the use of AI within healthcare or any other digital health initiative that is being explored. But to do this, nurses need to be informed and have some knowledge and experience about what digital health means to them in their practice. and this involves some learning and some reflection on behalf of the nurse. We're going to explore this topic at the workshop on the 3rd of December, and I'm really excited about this. We've got an amazing panel to really look into, how this can be done, and the people speaking on this topic. We have Matthew Parsons from the University of Waikato, Isabella Smart, who's a midwife from Manukau, Belle McPhee from Hospice Waikato, and Andrew Ingersoll from PwC. So a really diverse panel of different professions and people coming from different areas, and all talking about how we can amplify the nursing and midwifery voice in digital health, in particular with the workforce lens.
Great, thank you. And you're also, Emma, co-presenting on AI, digital health and nursing education. So can you tell us more about that session?
This session is really being led by the amazing Dr. Michelle Honey. Michelle is a long-time researcher in digital health, as well as one of the founding members and honorary member of the HINS NMI group, along with Lucy Westbrook and Robin Carr. Michelle has always had her finger on the pulse when it comes to new technologies and fads, and AI is no exception. A majority of this talk is going to be about the use of generative AI in nursing education, but the principles apply to beyond the nursing undergrad education space. All nurses and midwives are lifelong learners, and we may all be tempted or do use AI in some way, shape or form to help us. It might be to create content, or it might just be to check grammar. So it can be used in a wide variety of ways. This presentation is a condensed version of a workshop that Michelle participated in alongside a panel of international informaticians and researchers at the Nursing Informatics International Conference in July this year in Manchester. But not only will we be talking about using generative AI in education, but also how AI is becoming embedded into our daily practice. Once again, it just reiterates that point around, becoming informed and having some knowledge and reflecting on these uses of these technologies in your clinical practice. But you need to know a little bit about it to begin with. It's very topical, and we look forward to exploring that with our audience.
Yeah, interesting. I mean, we hear a lot about GPs taking up, AI scribes, and I've heard that it's happening a lot in allied health as well. What's your impression of the use of generative AI already in the nursing workforce in New Zealand?
Well, I think it's being used more than we realise it's being used. And I have no doubt that something like AI Scribe is being used in primary care for nurses who are having consultations with clients, and it's transcribing and it's informing their patient notes in that way. I suspect that if a GP practice is adopting this, they're adopting it for everyone in their practice who needs to document patient interactions. So it'd be really great to hear from anyone in the audience at our workshop if they are using one of these AI transcription services and how it's going for them. My general practice has recently just rolled it out, so I'm curious to go the next time I go there to whether or not they're going to ask my consent before using the AI transcription service. So we'll wait and see. Yeah, they won't see me coming, I'm sure of it. And in terms of, I also work clinically on the wards. I have not seen any AI transcription service used in clinical notes in the environment that I work in. And I'm really keen to hear from people at the workshop whether or not they're using it in their practice to help inform their clinical notes. So I'm excited to talk to people about how they're seeing the development of that.
Yeah, that question of consent's an interesting one, and something that's going to be explored at the main conference at Digital Health Week as well. So training in digital technologies is another strong theme at the workshop. Why is that? Alf, do you want to take that one?
I don't really want to stress the importance of learning or training. For me, it's about becoming aware of the impact that digital technologies can have on and within healthcare. It's everything from overarching strategies to operational plans and processes, but realistically, it's about being aware and informed about what's occurring globally in health and about having access to the information should it be required.
So you have another panel on turning plans into practice, digital solutions that actually work. Sounds great. So we all know a number of health IT projects do actually fail. I was wondering why you think that is, and how can engaging with nurses and midwives help them succeed?
If we really critically reflect and look at why some of the reasons are that health IT projects fail, there's a lack of, we've mentioned it, I think, multiple times at this point, but it's around those, lack of end user engagements. who is the system being designed and implemented for? Who will be using the technology daily? And is this nurses and midwives? And if so, should they not be engaged right from the start? And it's around things like poor understanding of clinical workflows. People develop systems, but don't actually understand how Alpha is going to take this medication to that health consumer and then administer that medication to that health consumer. And developers, I don't necessarily think they understand the complexity and the variability of the healthcare environment. And I think that, there are many reasons for how engaging with nurses and midwives can help. And it's around ensuring clinical relevance, talking to them about the actual problems that we face on the coalface, as opposed to people designing use cases about what they think without understanding their embodied experience. Really, we're looking to design for, real world workflows, because ultimately those systems that work and those really great digital solutions that have been implemented, they improve usability and, usability, and therefore they become adopted by many as well. Ultimately, we're looking at benefits to the clinical workforce by hopefully minimizing a portion of their workload, but we're also looking at benefits by delivering faster, more accessible patient care. And that's hopefully what we're going to cover.
Yeah, I'm really excited about this panel, Alf, and I'm really keen to hear more about things that are happening out there in the sector. I'm also really excited for the people in the audience who are new to this area of clinical practice to be inspired by these people on the panel who are working in a digital health space, and not one that might necessarily seem like it might be a little bit out of the box somewhat, or not kind of a conventional pathway for a nurse or midwife. But no doubt working in digital health and making really exciting choices and informed practices for nursing and midwifery practice moving forward and driving the profession forward. And I'm really excited to hear from these people and the inspiration that they're going to give people in the audience.
So what do you see as the greatest potential for data and digital transformation in nursing and midwifery, and why?
The greatest potential for data and digital transformation in nursing and midwifery is the nurses and midwives themselves. And we need to increase the dialogue in the space and be transformative in our leadership.
I think for me, and I agree with what you're saying, but I think that, unless the clinical workforce is sufficiently engaged, transformation will absolutely not occur. It's a moot point. And we will remain a world, of disparate and siloed systems which are not fit for purpose, and even worse, actually make the workload heavier. So what we have is we've got clinical people are smart, and we need those smarts to help solve some of those wicked problems that health is dealing with globally. And how can health actually do the transformation and assist us in managing these really heavy workloads and simplifying some of these really complex problems?
So if you are a nurse or a midwife listening to this podcast, so why should they go along to the workshop on December 3rd?
I think they'll be inspired. I think they'll make great connections, and they'll leave with a sense of passion for this area of nursing and midwifery and a need and a want to do more in this space. There's always just so many connections and so much great inspiration that comes with these events.
What can I say? It's an interesting and dynamic day. It's an opportunity to network. And that's really the crux of it. The more people that we can talk to, that we can network with, the more opportunity we have in solving some of these massive problems.
Definitely. And we'll even chuck in some lovely morning tea and lunch, and you can come along. You can stay for the evening plenary sessions. You'll get to hear some of the keynotes from Digital Health Week and the welcome drinks. So you get that sort of full conference experience of the exhibition hall and everything. So it's a really great day and a great opportunity, like you said. So thanks for joining me today, Alf and Emma. If you are interested in finding out more about the workshop, you can visit hins.org.nz and click on events and Digital Health Week. So we would love to see you there. Mās tev.
Thanks for listening to eHealthTALK. Be sure to subscribe and share with your colleagues and friends. eHealthTALK, eHealth News and the eHealth webinar series are supported by Health Informatics New Zealand. See hins.org.nz for more information and become a member starting at just $17 a month. We also have affordable organisational membership options for both our industry partners and healthcare providers.